Mr. Chairman, dear colleagues, thank you. Now we move to another topic, the endocrine pancreatic tumors. They are rare tumors, but their incidence is increasing and is expected to continue to increase in the next years. As you know, the therapy of these tumors is quite complex. We have to choose among different therapeutic options, and frequently the choice is not easy to make because our knowledge about clinical pathological characteristics of these tumors and also on natural history of this disease are quite scanty. And this is the reason for which the Italian Association for the Study of the Pancreas planned some years ago an epidemiologic study in which all new diagnosed cases observed in a 3 years period were enrolled, and each case was followed up for a minimum of 2 years. And this was a prospective multi-center study. It's important to underline that only new cases were enrolled, so each center was not allowed to enroll cases which were already in follow-up in these centers. The board of the study was chaired by Professor Di Carlo, and there were 24 centers participating in this study. Half of them were surgical departments, and the other 12 were representative of endocrinological, oncological, and also nuclear medicine departments, because we tried to represent all the different types of centers that usually observe and manage this type of tumors to have the most reliable picture of these types of neoplasm. The centers were scattered along all the country, even if the majority of cases were enrolled in the north of Italy, but we tried to cover all the country, and we recruited 349 cases in a 3-year period. That is a big number, even higher than expected. We have elaborated data of characteristics of patients at recruitment. We have not still data on the 2 years follow-up. And one of the main findings was that 3/4 of patients were non-functioning neoplasm, and about half of this non-functioning neoplasm were asymptomatic. So diagnosis was incidental in half of non-functioning patients, in a great proportion of patients we observed. We recently published on American Journal of Gastroenterology the data relating to the data at the recruitment, and I show to you this data. We, in this slide, compare the characteristics of patients with functioning and non-functioning tumor. As you can see, female gender was more represented among functioning tumors, and an important finding was that tumor diameter was, on overall, quite small. We had 3 centimeters of mean diameter of our neoplasm, which is quite a low figure in respect to data usually reported in the literature. Tumors were smaller in functioning tumors, and non-functioning tumors were more frequently malignant in respect to functioning counterpart, as what you can see is that lymph node metastases and hepatic metastases were both higher in non-functioning, but on overall, the rate of malignant tumors we recruited was quite low respect to the usually data reported, because only about 30% of cases show a malignant behavior for the presence of metastasis at the WHO classification. as already mentioned, about half of patients with non-functioning tumors were asymptomatic, and we compare the demographic characteristics in these two groups of patients because these are two different clinical situations for the physician. We observed that asymptomatic cases were more frequently discovered in the body tail of the pancreas, whereas the symptomatic forms were more represented in the head. And from an oncological point of view, asymptomatic forms were more frequently benign than the symptomatic ones. And you can see that it was a significant difference in the presence of both lymph nodes and hepatic metastases. We went more in details in the usefulness of the determination of Ki67, as you know, is an important proliferative index of this neoplasm. We were able to have this data in almost all our cases, and this is an important result of our study, which underlined the high quality of the cases recruited. We divided the patients in 4 categories according to the value of Ki67, and we observed a linear relationship between both the size of the tumor and also the rate of nodal and liver metastases and the levels of Ki67. And also our preliminary data on outcome of the patients, on prognosis of these patients, confirm the important role of this marker on the prognostic assessment of this neoplasm. Another important finding of the study was the very high proportion of patients treated by surgery at the first observation. You see that 84% of patients were treated by surgery at enrollment, and in the majority of cases, surgery was a radical surgery. And another important finding is that only in a minority of patients, the surgical treatment was done by laparoscopy. At recruitment, 30% of patients were treated by therapies different from surgery, in the majority of cases, but somatostatin analogs, a small proportion by chemotherapy, and a few cases by peptide receptor therapy and ablative liver treatment. Outcome of surgery was quite good, with a very low mortality and an acceptable morbidity, and in a multi-center study, these are quite good figures. And another important aspect which comes from this study is that in a high proportion of cases, the type of radical resection was done by parenchymal preserving resections, I mean enucleation and middle pancreatectomy. And this high proportion of atypical pancreatic resection is the role of this type of procedure is confirmed by another study recently published, which we did together, the Verona group, in which we collected 50 cases of enucleation or middle pancreatectomy. These two procedures confirmed to be quite safe for the early postoperative period, with very good long-term results for what both exocrine and endocrine pancreatic function are concerned. Also from an oncological point of view, at a long follow-up, you see 68 months of mean follow-up, we observed only 4 tumor recurrence, underlying the role of this resection, the important role of this resection, even if we have probably to better define the indications to these procedures, to add routinely nodal sampling to avoid to miss some carcinoma, and to avoid this even low rate of tumor recurrence, which was 80% in this series. Only in a minority of patients, surgery, resection was not a radical resection, but was done as a palliative intent, only about 15% of cases, with no difference among the histology of the tumors, well differentiated or poorly differentiated cancer. And this behavior of Italian surgeons was correct because it's in accordance with the recent INETS guidelines, which underline that debulking in unresectable endocrine pancreatic tumor is not recommended. So, in conclusion, from our study, we can underline that the number of non-functioning and incidentally discovered forms are probably even higher than usually thought. There is probably a trend towards an early diagnosis because we observed a smaller size than in series present in the literature, and also the rate of metastasis we observed was lower. Surgery is confirmed to be the cornerstone treatment of this neoplasm, performed in more than 80% of cases, and the parenchyma preserving procedure are showing a growing role in this disease, whereas the pancreas surgery probably is not as effective as thought before. Thank you for your attention.